Hi, this video we're going to go through strengthening exercises for the scalene muscles. Now, with the scalene muscles, they're located in the front of the neck area, and they're responsible for giving us a lot of pain going down the arm. They can give you pain going to the chest, into the shoulder area, actually into the mid-back also. These muscles are pretty sensitive. The big problem with these muscles is that you got nerves and arteries coming out from the same area. So a lot of times people think that they got nerve impingements, but it's actually scalene muscles that'll be giving them the problem. So for strengthening, what you want to do is you want to hit the trigger points in the scalene muscles first. Address them first. Once the pain starts going down, then you can get into a bit of scalene stretches, which is we go through in another video, or you can go through what we call scalene strengthening exercises. Now, how many exercises are there? There's a million of these. Now, the thing is, you don't have to worry about a lot of different exercises. Treating people with trigger point pain, scalene muscle trigger point pain for over 20 years, I've kind of come down to maybe one or two exercises that you kind of need to do. So as long as you can take those trigger points out and the pain starts coming down, you can work into doing one strengthening exercises for those scalene muscles. And that exercise is called cranial cervical flexion exercises. And it's very simple. All you're really going to do is you're going to lie down, and you're going to tuck your chin in. And as you keep your chin in, you want to try to lift your head up about an inch off the ground. Now, as you do this, you may start realizing your head's going to start shaking. You're not going to maybe feel a lot of stuff in the front of the neck. You may be feeling a lot of stuff in the back. But as long as you're doing this exercise the right way, we're getting the deep muscles in our front of the neck activated. Now, whether we're targeting the scalenes or we're targeting deep flexor exercises, it doesn't matter. Now, those are the things you leave it for your clinician. But for you, just remember, generally, just get this exercise, strengthen your neck muscles, do it while you're doing it. A few weeks later, 2, 3 to 6 weeks later, you're going to start noticing a difference. Now, if you're going to do this exercise the wrong way, what ends up happening is a lot of people, they tuck their chin in and they lift their head up, but their chin comes back out. Now, that's the wrong way to do it. And that just means you got to really focus on keeping that chin tucked in. Another thing that people do wrong is they lift their head up. Instead of an inch, they lift it up all the way. And again, that works other muscles. We want to make sure our head's up 1 inch, chin is tucked in, and your head's going to start shaking a bit, and that's the optimal position to be in. Now, when you do this exercise, it's not like you want to hold it as long as you can. You're forcing it. And it's not like that. You want to hold it, and as soon as you find out that your chin's coming out or your head's shaking too much and you can't keep it in that position, you bring your neck back down. You rest for a few seconds and you repeat it. It's all about repetition of exercise, but using quality movements rather than quantity. So you want to go do it with the right position. If you start getting out of that position, you stop. Another interesting thing is you want to do this exercise rotating your head. So you rotate your head a little bit, keep that chin tucked in, and then lift your head up. Again, you're going to work a lot of the muscles in the front. Bring your head back down and rest. So at the end of the day, this is probably the best scalene strengthening exercise that I've been able to give to my patients. 80% of the time, this one's going to work. Now, another thing to remember, if you start this exercise and you start finding out all those aches and pains from those scalene trigger points are coming back, you want to stop. You want to go back into doing trigger point treatments for those scalenes, and then once the pain starts going down, come back into the strengthening. You don't want to keep pushing it. You want to always make sure that you're not getting that same pain coming back. Also, with these types of exercises, it can take, I'll be honest with you, it can take up to 3 months to actually start seeing some significant differences. That's why this is an exercise you want to do. Ingrain it as a habit. Do it once a day. Do it 3 times a week. You can do it in the morning or at nighttime when you wake up out of bed. So you can do it right in your bed. But the key is consistency. Be consistent with this exercise as long as it's not increasing your pain, and you're going to notice this huge significant changes in your neck pain. Also, this exercise really helps when our head's forward all day. So if we're in a forward head posture position, this is one of those strengthening exercises that you really need to do. So at the end of the day, strengthen your scalenes, do one exercise, that's it, that's all I'm recommending. And if you need any more information on scalenes or any other muscles, go to wizardofhealth.net and you can find a lot more information there. I'm Dr. Jasper, and we'll see you guys in another video.